Good afternoon. My name is Natalia Camargo, and the fourth question. The following congenital heart lesions are cyanotic. A question A. Ventricular septal defect. This question is false. And the answer is ventricular septal defect is a defect in the wall septum between the two lower chambers of the heart ventricles. A septal defect is commonly referred to as a hole in the heart. Normally, the right side of the heart receives blood with little oxygen and pumps it to the lungs where it fills with oxygen. The blood is then sent back to the left side of the heart, which pumps blood with high oxygen content to the rest of the body. But why the VSD, the heart pumps inefficiently? Blood with high oxygen content is pumped back into the lungs. Ventricular septal effects occur when the division process doesn't occur completely and there is an opening in the ventricular septum. Some congenital heart defects may have a genetic link that causes heart problems that occur more frequently in certain families. For example, Down syndrome. Most interventricular communications occur by chance with no obvious reason for them to develop. Question B. Atrial septal effects. This is false, and atrial septal effects allow freshly oxygenated blood to flow from the left upper chamber to the right upper chamber of the heart, left and atrium and right atrium of the heart. There it mixes with the deoxygenated blood and is pumped into the lungs. Even though oxygen has already been replenished in the interatrial communication, this extra volume of blood can over the lungs and causes the right side of the heart to overwork. If left untreated over time, the right side of the heart enlarges and weakens. This is process continuous. It can also increase blood pressure in the lungs, which causes pulmonary hypertension. Question C. Patens ductus arterius. The answer is the patens ductus arteriosus occurs when the ductus arteriosus doesn't close properly after birth. This failure leads to increases flow to the pulmonary circulation and a volumetric overload in the atrium and left ventricle that leads to a series of problems such as hypertension pulmonary and edema. However, all this depends on the caliber of the ductus arteriosus and when it less than 0.5 mm doesn't show symptoms, while a large caliber or moderate is greater than 3.5 mm. Symptoms ranging from dyspnea and tachycardia at rest, even respiratory infections. To remedy this anomaly, the use of intravenous NSAIDs is used, which reduces the problem in most cases without presenting complications. If the problem isn't correct with the use of drugs, and this doesn't present hemodynamic instability and pulmonary hypertension and percutaneous closure with a coil device is done if it is less than 3.5 mm and with unpleasant if it is greater than 3.5 mm. If the above is present, surgical closure is necessary. Okay, and the last question is the tetralogy of Fallot. The answer is tetralogy of Fallot is a condition that brings together various congenital defects due to abnormal development of the fetus heart during the first 8 weeks of pregnancy. In the tetralogy of Fallot, blood flow within the hair varies and depends, to a large extent, on the size of the ventricular septal defect and the severity of the obstruction in the right ventricle. Tetralogy of Fallot can also occur as a part of a syndrome such as Down syndrome or DiGeorge syndrome. The tetralogy of Fallot consists of the following 4 defects of the heart and its blood vessel. 1. Interventricular communication. A hole in the wall between the 2 ventricles of the heart. 2. The narrowing of the pulmonary valve and the main pulmonary artery. This condition is also called pulmonary stenosis, and this causes some difficulty for the blood to pass into pulmonary circulation. And 3. Aortic clipping. The aortic valve is larger than normal and seems to open from both ventricles. Thus is it located above the ventricle septum defect and not just in the left ventricle as in a normal heart. And 4. Hypertrophy of the right ventricle. The wall of the right ventricle becomes thicker and more muscular than normal because it needs to contract with more force to overcome the resistance caused by stenosis in the pulmonary valve. Okay, thanks, bye.